Hi, my name is Angie, and I'll be performing a newborn assessment today. So when I'm doing this, I'm going to enter the room, introduce myself to mom, let her know what I'll be doing today, check her wristband and baby's wristband, make sure they match, and perform my hand hygiene. Then if the baby's resting, it would be a good time to start with the vitals. So I could observe chest rise and fall for a full minute to get the number of respirations. Then I could use my stethoscope using the bell side to listen to heart sounds and also count apical heart rate for a full minute, and then also listen to lung sounds. Using the bell of the stethoscope. So just very gently trying not to disturb the baby. So I'd do that. And next I would get a blood pressure, so that could be on the right arm or the left leg. That's probably gonna wake the baby up, so that's why we do the heart rate and respirations first. Gonna do that. And then last will be the temperature. So I'm going to take the probe, usually doing it in the axillary area. So just making sure it's between skin and skin. So just moving any clothing or blankets they may have around and making sure it's right in their armpit and like between skin and skin. And then just pressing their arm down like this to make sure the probe is fully covered inside the armpit. Okay. And after gathering vitals, I could go on with the assessment. So could do APGAR, so that would look at activity, pulse, grimace, appearance, and respirations, get an APGAR score. Usually that's done after minute 1 and 5 after birth, so depending whenever I'm doing this assessment. Next, going on to the head, I would palpate on the baby's head, checking the suture lines here, the molding, then also palpating their fontanelles. The anterior one should be a diamond and the posterior one should be a triangle. Both should be flat. Bulging or sunken would be abnormal signs. Moving on to eyes. The baby's eyes can open, turn on my pen light and shine it inside, see if pupils are reactive. Next, looking at the ears, with checking that the top of the ears, kind of high on this cat, but checking that the top of the ears align with the lower canthus of the eye, just visually inspecting that. Then also checking for any skin tags that might be on the ears. That could have correlate with any like renal problems the baby might have. Next, looking at the nose, I would just assess patency in the nostrils. So just covering one at a time, doing that on the baby, seeing that they're patent, suctioning as needed if there's some stuff going on in there. Next, I'm going to check the baby's mouth, or just the mouth area. So at this point, I could check for the rooting reflex. So just rubbing the patient's cheek or the baby's cheek or leg around the corner of their mouth, see if they turn towards it. And also with the mouth, usually using my pinky just to check inside, palpate around inside the baby's mouth, check for the sucking reflex, and also assessing for any cleft palate or any abnormalities inside the roof of the mouth. And speaking of reflexes, also at some point during the assessment, I could check for the Moro reflex, the startle reflex. So a lot of times if I'm like going to be carrying the baby, just having like any sudden movements or like that I've seen, or when there's a loud sound, sometimes the baby will make the startled face, palms up, and just kind of extend out. So that can be done kind of at any point also, just speaking of reflexes. Then let's see, so we finished the head. Next, we can start looking at the rest of the body. So looking down at the abdomen, just inspect for any rashes, discolorations, things like that. Check to see if the arms and legs are flexing, checking for good muscle tone. Also checking all the fingers and toes, making sure there's 5 on each hand, each foot, and there's no webbing present. Let's see. Then also with more reflexes, checking the palmar and plantar reflexes. So with the hand, like the fingers will curl around my finger, and then same with the bottom of the foot, the toes will curl down. And then also with the foot, you can check Babinski. So instead of curling down like with the plantar grasp, with Babinski making that shape on the bottom of the foot, then the toes should extend out like that. So that would be the Babinski reflex. Then while assessing arms and legs, can also check for pulses, femoral pulses up here, checking all pulses bilaterally, maybe brachial up here for the arms, femoral down here for the legs. Let's see. And then also checking the genitalia. So if it's a boy, you want to check for the foreskin, making sure everything is intact, and also palpating both testicles, and making sure the meatus of the penis is midline. It's not, too high or too low or anything like that. For girls, you want to check the labia, majora and minora, make sure they're intact and that there is a clitoris underneath all the folds there. Here on the abdomen, you also want to check the umbilical cord, so assess for any redness, swelling, drainage or bleeding. And then sometimes you can see also the AVA, so 2 arteries and 1 vein inside the umbilical cord still present. Then picking up the baby or just turning them to the side, checking the back. So just checking the spinal curvature here, and then in the lower back area, you want to check for any Mongolian spots and making sure those are well documented. Also checking for any sacral dimples or tufts of hair, which could be indicative of spina bifida or just any other abnormalities in this area. Then can lay baby back down. Can also gather some measurements during the assessment. So usually like after birth, they measured the length of the baby. Then also like during, like while they're in the unit and stuff, you could check the circumference of the head. They have the tape measures, paper tape measures, checking the circumference of the head and the chest, making sure they're in appropriate proportion. And I think that just about hits all the highlights of the newborn assessment. Following the assessment, it would be good to inform mom of any abnormal findings, or just letting her know like what you saw, if anything requires follow-up with the doctor, notifying the provider. Then also maybe some education, such as keeping things outside of the crib, not too many toys or anything inside, just kind of the blankets and what the baby needs. And then also maybe educating on how to use the bulb syringe when the baby has like some mucus or any kind of like discharge coming out, just so when the nurse is not around, mom can also clean up the baby and things like that. So yeah, that wraps up the newborn assessment.